All right, here we are with chapter 37 in Abdominal and Genitourinary Trauma. And this chapter is broken up into two parts, so it's not too bad. And let's go ahead and get started. So remember, the abdominal cavity is one of the largest cavities in the body, if not probably the largest, stretching from the diaphragm all the way down to the pelvis. So managing injuries in this area can be difficult because patient presentations vary greatly and injuries can easily be life-threatening. The abdominal cavity houses several vital organ systems that are vulnerable to trauma due to their location and the lack of protection of the skeletal system. So it's kind of an open area that can easily be traumatized. Trauma can be caused either by blunt force trauma or a penetrating object, and the amount of damage can be lessened if the patient has an empty bladder, which seems odd, but that hollow organ will absorb energy, or if they have well-toned abdominal muscles, that will actually also help reduce the likelihood of an injury to the abdominal region. Trauma to the genitourinary system can be caused by blunt or penetrating forces. The kidneys are the organs that are most frequently injured when this happens. You should consider the possibility of genitourinary system trauma whenever there are injuries to the lower rib cage, abdomen, pelvis, or the upper legs. The genitourinary system injuries should be kind of part of the equation when we see those things happen. Assessing and intervening in abdominal injuries must be done quickly and with caution, as delays in care can have fatal consequences. A patient's assessment can be challenging if their mental status has been altered by other injuries, or even intoxication or drug use, or if they have sustained injuries to the brain, spinal cord, or adjacent structures. Significant efforts have been made to reduce death and complications from abdominal trauma through better pre-hospital provider education, some advances in hospital care, and the development of trauma systems. Your account from the field, what we see in the field, and we say this a lot, but what you say and see in the field is often the only source of information that physicians and surgeons have to go off of in order to be able to understand the events and mechanisms associated with that particular traumatic incident. So let's go over just a quick review, anatomy physiology review, so we're all on the same page. Not going to get real in depth, but we're just going to kind of bring things up to the surface so that we're all on the same page and we can easily understand it. Oops, sorry about that. Picture's kind of over the wording there, but we'll get through it. The abdominal cavity stretches from the diaphragm all the way down to the pelvic brim. The pelvic brim is an angled line from the disc between L5 and S1 to the pubic symphysis. Knowing the anatomical boundaries of the abdominal regions is really important for identifying potential injury patterns, such as injuries to hollow organs or blood vessels versus solid organs or the retroperitoneal area. And in this image here, it just kind of shows the standard 4-quadrant regions that we oftentimes associate, but you can also use the 9-quadrant that has the hypogastric and hypogastric areas, the umbilical area and all that. You can use that 9-quadrant breakdown to have a little more precise area, especially when you're documenting or when you're relaying your information to the receiving hospital. But we do typically use the quadrant system to describe the location of the pain during the assessment. If we want to get more detailed, we can use the more detailed one. The area surrounding the umbilicus or belly button is known as the periumbilical area, and oftentimes it is associated with some injuries. This abdominal cavity contains a lot of organs, most of which are part of the digestive system. The peritoneal cavity is a large area in the abdomen that is encased in the peritoneum. So it's all kind of housed together. Everything's kind of held together by the peritoneum. The upper peritoneal cavity contains the diaphragm, spleen, stomach, gallbladder, transverse colon. The lower cavity, you'll find the small intestine, the sigmoid bowels, parts of the ascending and descending colon, and the internal reproductive organs. The retroperitoneal space is the area located behind the peritoneal lining of the abdomen. And here's just a diagram of some of the organs. This is mainly the ones that we're kind of looking at in the genitourinary, that has you can see the kidneys, of course. What are we looking at here? You can see parts of the aorta, those kinds of things. The pancreas. That's what I was seeing in there. I was trying to figure out what that was. Here's another view of that and the organs that we see. And realize these views are very simplistic. It doesn't show all the vessels and all that kind of stuff. There's just really no good place for a penetrating object to go through the abdomen that it's not going to cause some sort of issues along the way when it does. The liver is one of the bigger organs that we're concerned about because it's highly vascular. It's located in the right upper quadrant, sitting above and in front of the gallbladder. And the hepatic and cystic ducts, as well as the stomach, are kind of located in that area as well. The liver has that significant blood flow, as I mentioned, and this is provided by that hepatic artery and the hepatic portal vein. Those are both susceptible to injuries, especially in a shearing or tearing force type of traumatic event. And lots of blood can be lost quickly if either one of those are torn. The spleen is another highly vascular organ located in the upper left-hand quadrant. It's a soft organ, shaped a little bit like a catcher's mitt, but it is also one that is commonly damaged in traumatic events, especially those involving the abdomen. The spleen, another highly vascular organ located in the left upper quadrant, is a soft organ. So it can easily be damaged as well. It's a little less likely to be damaged like some of the other organs are, but it can be damaged. A lot of times it's the ligaments that are supporting it that causes the damage to the pancreas. The stomach is it's one of the hollow organs. It's an intraperitoneal organ that lies in the upper left-hand quadrant of the epigastric region, where it, of course, serves as the storage area for ingested foods and liquids until the digestive enzymes begin to work on those. And it begins to pass through the digestive system, where all the good, healthy stuff or even the bad stuff, is absorbed. The gallbladder is a sac-like organ that sits in the lower surface of the liver and acts as a reservoir for bile. And of course, this bile is used to break down the foods that we ingest into our bodies, mainly the fats. The small and large intestines extend from the end of the stomach all the way out to the exit of the body. Most of the intestines are located in the intraperitoneal area, and the primary function is to digest food and absorb water and nutrients. That's what it's there for. And it takes that much of it to do that effectively and efficiently. The abdomen also contains the organs of the urinary system. The kidneys are located in the retroperitoneal space, where they filter the blood and excrete the body waste as urine. The urinary bladder is a hollow muscular sac situated in the pelvis that stores urine until it is excreted from the body. And of course, the ureters are the tubes that carry urine from the kidneys to the bladder so that it can make its way to the exit. The abdomen also contains organs of the reproductive system. We have the female reproductive system that can be injured by crushing injuries, compression, and shearing forces. Remember that the organs of the female reproductive system are primarily internal, or nearly entirely internal, and therefore they're really difficult to assess for damage and those types of things. Oftentimes the only evidence that we have of injuries to the female reproductive system is some form of bleeding, that's coming out externally. The male reproductive system, injuries to this area are typically pretty obvious because all of the reproductive organs, or nearly all of them, are external. So much easier to provide an assessment of some kind to see if there's any issues there. The diaphragm is a dome-shaped muscle that separates the thoracic and abdominal cavities. It curves from its points of attachment in the flanks, with its peak reaching the fourth intercostal space in the center. Following a blunt or penetrating injury, a significant amount of blood can be lost into the abdomen, retroperitoneal space, and the muscle compartments of the upper legs. This internal bleeding can be difficult to detect because it may present with very few signs and symptoms, and vital signs and physical exams may not indicate the true extent of the blood loss. Solid organs can be easily crushed by blunt trauma to the abdomen. The spleen is the most commonly injured solid organ from blunt trauma, while the liver is the second most common, and it's the most frequently injured with penetrating trauma, which has a lot to do with because of its size of how big it is. Always suspect abdominal trauma if a patient has unexplained symptoms of shock. Hollow organs are generally more resilient to blunt trauma, but they can easily burst if they are full. If a hollow organ ruptures and spills its contents, it can cause peritonitis, which is an inflammation of the lining of the abdomen, and this can also lead to sepsis, which can be very life-threatening. Chemical peritonitis can have a sudden onset, while bacterial peritonitis may develop slowly over the course of several hours. So, it all just depends on what is in that particular hollow organ that gets leaked out, causing the peritonitis as far as it relates to how quickly the symptoms will develop. Bacterial peritonitis can be categorized further as either primary or secondary. Primary peritonitis occurs when the infection travels from the blood or lymph nodes into the peritoneum. Secondary, which is more common, happens when an infection spreads from the gastrointestinal or biliary tract into the peritoneum. All right, so now let's dive into some of the mechanisms of injury that we're going to see with abdominal trauma. It is important to have a high index of suspicion and to understand the mechanism of injury in a patient who is exposed to blunt trauma, which can occur as the result of falls, various types of vehicle crashes, or any direct force that strikes the abdomen. Penetrating abdominal trauma most often results from stab wounds or gunshot wounds. Sometimes a patient can have a combination of both blunt and penetrating trauma, but it's not typically what we see. The likelihood of significant internal abdominal injury is high if a patient has hypotension in the field and a major chest injury as well as suspected pelvic fractures. Unrecognized abdominal trauma is the leading cause of death in trauma patients. Abdominal injuries are most often the result of blunt trauma, which is associated with a mortality rate of 10 to 30%, that's fairly high for trauma patients. A direct blow to the abdomen can cause compression and crushing injuries. A closed abdominal injury is when soft tissue damage happens inside of the body, but the skin remains unbroken on the surface. Now, the image that you're seeing on your screen here is showing some bruising to the abdominal wall or to the skin on the exterior surface of the abdomen. This would be a late sign of an injury. This is not typically something you're going to roll up to on a car accident and see bruising like this show up right away. If it does show up right away, it should be considered a very ominous sign. Shearing is an injury mechanism caused by rapid deceleration in a vehicle crash or a fall. During a sudden stop, internal organs continue their forward motion, causing them to shear, especially at the points of attachment to the abdominal wall. And these are going to be the ligaments or the tendons that hold those organs in place. During a sudden stop, internal organs continue to move forward, causes them to shear. The organs most prone to this type of injury are the liver, kidneys, small and large intestines, as well as the spleen. In motor vehicle collisions, this is sometimes called a third collision. This crushing injuries is a type of injury that is the result of external factors that apply a direct crushing force to the abdomen at that particular time of impact. It occurs when the abdominal contents are crushed between the front of the abdominal wall and the spinal column. Solid organs are at the greatest risk when this happens, especially the kidneys, liver, and spleen, which top the list of organs that are typically injured in abdominal injuries, traumatic abdominal injuries. Compression injuries can occur as the result of a direct blow or an external compression against a fixed object. This force increases pressure inside of the abdominal cavity, which can deform hollow organs. The increased pressure can cause organs like the small intestine or diaphragm to rupture, which may lead to uncontrolled bleeding or peritonitis. Penetrating trauma results in tissue damage by lacerating or cutting, which creates an open abdominal injury. Generally, gunshot wounds cause more injury than stab wounds because the bullets travel deeper into the body and have much more kinetic energy that needs to be dissipated. This kinetic energy increases the damage to the tissues lateral to the bullet's path due to the temporary vacuum effect called the temporary cavitation. So the cavitation that opens up as that bullet passes through. The extent of the injury, of course, is going to depend on the specific weapon and size of bullet that causes the injury. Gunshot wounds to the abdomen most commonly injure the small bowel, colon, liver, as well as major blood vessels that oftentimes get in the way. When dealing with penetrating trauma from stab wounds, the organs most frequently injured are the liver, bowel, diaphragm, and colon. There are 5 typical patterns of impact in a motor vehicle crash. These are frontal, lateral, rear, rotational, and rollover. And these shouldn't be too surprising what these are, but a frontal impact is when patients can be thrown forward through the windshield or up and over the hood of the car. This type of crash can cause traumatic disruption to the aorta, liver, spleen, and injuries and many other types of non-abdominal injuries as well. When we talk about lateral or side impacts such as T-bone collisions, in these, the diaphragm, pelvis, and either the liver or spleen are often injured. And of course, this is going to have a lot, which side of the body is impacted by this collision is going to make it the biggest determination of what all injuries we might see. When rotational forces are present, they often result in injuries to the cervical spine and abdominal organs. And this is especially true of those attachment points because of that twisting effect of that. Rear impact collisions that will impact the intra-abdominal areas of the body and can occur from both compression and deceleration forces on the body because of that rear impact. Rollover impacts is when what we typically see is when the occupants may collide with each other and the vehicle's interior as well, which can result in a wide range of potential injuries to those patients that could include injuries well beyond abdominal injuries as well. Patients who are properly restrained are less likely to have an abdominal injury. For a seatbelt to be worn correctly, it should lie below the anterior superior iliac spines of the pelvis and against the hip joints. However, improper seatbelt use can cause compression injuries to the pancreas, liver, spleen, small bowel, kidneys, and whatnot when the car suddenly decelerates or stops. This is especially true if a child is too small and they're placed in an adult seatbelt in a vehicle. We oftentimes see lots of abdominal injuries with those patients. Unlike a car, there is no structural protection on a motorcycle crash. A motorcyclist's only protection comes from the protective gear that they are wearing. While helmets do offer head protection, they can transmit impact forces to the cervical spine and providing no protection against severe neck injuries. Consider transporting a patient to a trauma center if their crash involved speeds of greater than 20 miles per hour or if they were separated from the motorcycle. Falls from heights in adults are often the result of working on an elevated surface or an act of self-harm or something that may involve some kind of intoxicant. The types of injuries and a person's chance of survival are going to be determined by their body's position and the orientation during the fall. The forces from the sudden stop are absorbed by the surface a person lands on, and how much of that surface can be deformed upon impact. So if the surface is soft sand and that surface is able to absorb some impact versus asphalt or concrete, it's not going to absorb any impact, and the body's going to have to absorb all of that impact and disperse all of that kinetic energy. Consider immediate transport to the trauma center for adults who have fallen from a height of greater than 20 feet. For children, consider immediate transport for falls greater than 10 feet or 2 to 3 times their height. Blast injuries can generate fragments that travel at velocities up to 4,500 feet per second, which is nearly double the velocity of a projectile from a high-speed rifle. The energy transmitted from a fragment will cause extensive and disruptive tissue damage throughout the body, but especially in the abdominal cavity. So when we take a peek, just a quick peek at general pathophysiologies, hemorrhage is a major concern in patients with abdominal trauma, and it can involve both external and internal blood loss. It's very difficult to accurately estimate the volume of blood a patient has lost, so the signs and symptoms a patient shows may vary greatly depending on the volume and the rate of blood loss that they're experiencing. Increased hypovolemia can cause a patient to become agitated and confused. To compensate, the heart increases its heart rate and stroke volume, but the increased hypoperfusion can lead to ischemia and heart failure. Symptoms of cardiac dysfunction include chest pain, rapid breathing with abnormal lung sounds, and dysrhythmias. If left untreated, this can also lead to anaerobic metabolism and acidosis. Injuries to the abdominal organs can cause their contents to spill into the abdominal cavity, irritating the nerve endings in the surrounding fascia. This irritation will eventually cause inflammation and localized pain. The pain remains localized if the contamination is contained, but it becomes generalized if the entire peritoneal cavity becomes involved. All right, enough on pathophysiology in part 1. That's the end of part 1. We'll get back with part 2, and we'll get into some more detailed injuries that we expect to see in the abdominal trauma patients.